Hey guys, good evening. Welcome back. This is episode 2. Let's ask the doctor. And today we have one more amazing psychiatrist, a neuropsychiatrist, Dr. Charan. And yes, let the followers join in. And Dr. Charan is a consultant neuropsychiatrist. You can have your questions sent. Hello, Farah. Farah Khan. Okay. I don't know what happened to this. How do I? Okay, like this I can wave. So let people join in and then we are going to start the live. Okay. Hello, Slav. How are you? Garima, Rajesh. Hello. Guys, hang in there. Today we have an amazing live session with a consultant neuropsychiatrist. From Srigafara. Okay. याद नहीं आ रहा, बट Srigafara याद है. Hello Nitish. Hello Sneh. Okay. Guys, today we have an amazing guest. We're going to talk about mental health, physical health with a consultant neuropsychiatrist, Dr. Charan. Where are you from? I am based out of Gurgaon. I was born in Kashmir, brought up in Jammu, did my college from Bangalore, but I live in Gurgaon, Delhi NCR, after I finished my college. So I'm settled here, my family is here. Okay, hello Mansoori, Fazil. Okay. So how are you guys doing? आप सब कैसे हैं? आपका दिन कैसा था? आपका कॉलेज काम सब कैसा चल रहा है? हेलो इकबाल, समन इकबाल. ओके. हे नैंडिक्शन, हाउ आर यू? Hello, Beyond the Belief. Hey guys, amazing to see you all. We have an amazing guest today, a consultant neuropsychiatrist. So Dr. Charan would be joining in. Hello Mishti. हेलो आरती. एंड अगर आपके कोई भी क्वेश्चंस है मेडिसिन को रिलेटेड, साइकेट्री के रिलेटेड, he'll be happy to answer. हेलो हर्षल. हेलो आसिफ. हेलो निर्मला. राइट? ओके. I'm just trying to take the... हेलो चंदना. एंड डॉक्टर चरण हमें बहुत ही जल्द ज्वाइन कर रहे हैं. I'm doing good. Thank you so much. And thank you so much for joining in. Hello, Asif. Hello. So, guys, mental health के regarding आप, hello for your journey. आप लोग मुझे DMs करते हैं, आप लोग questions पूछते हैं, तो I would appreciate कि आज अभी ये एक live session at 7 at 10 PM और एक live है मेरा. आप वो questions पूछे ताकि आपको तो help होगी ही होगी, बट और लोग जो वो क्वेश्चंस नहीं पूछ पाते हैं उनको भी हेल्प होगी. सो दैट वुड बी रियली अप्रिशिएटेड इफ वी गेट द क्वेश्चंस हियर एंड दैट्स नाइस. हेलो वीरू चेक. चेरिस्ट कैप्चर फोटोग्राफी. हेलो. बहुत खूबसूरत चिनार का पत्ता है वो. मैं बिल्कुल ठीक हूँ वीरू, आप कैसे हैं? मैं कोशिश कर रही हूँ कि डॉक्टर चरण को मैं मैसेज करूँ कि वो कहाँ रह गए हैं. यस. ओके. सो आप लोगों की क्या क्वेश्चंस हैं मेंटल हेल्थ के रिलेटेड? मेंटल हेल्थ, ओवर थिंकिंग, कन्फ्यूजन्स, काफ़ी चीज़ें, ये सब छोटी छोटी चीज़ें भी होती है. ऐसा नहीं है कि हमें क्लिनिकल डायग्नोसिस चाहिए किसी चीज़ के लिए. नाइस टू सी यू लाइव. यू आर डूइंग अ really very good job by going live and ask question on behalf of public. Wow, that's amazing, Harshal. Harshala. And thank you so much. I guess, हमें ये appreciations चाहिए. And yes, we are trying our best. दीदी आज प्रॉमिस डे है, मैं प्रॉमिस कर रहा हूँ जिंदगी भर दीदी मानूंगा। अरे रिश्ते ना भी बनाए वीरू, मैं फिर भी यही हूँ। थैंक यू सो मच। ओके, सो डॉक्टर चरण इज हियर, accepting the request, and we are going to go live. Hello, Dr. Charan.
Hello, hi.
How are you?
I'm good, thank you. How are you doing?
Very well, thank you so much. How was your day?
Stressful.
Oh my God. डॉक्टर्स ऐसे बोलेंगे तो हम लोग क्या बोलेंगे?
We doctors only preach, you know. We are not very good at maintaining work-life balance, unfortunately. I'm confessing.
है ना? I am surrounded with so many doctors and सबका यही हाल है। लोगों को तो बहुत ठीक करते हैं लेकिन खुद बहुत स्ट्रेस में रहते हैं।
Yeah, true, true.
But thank you so much. Thank you so much for taking out time and doing this live with me. I am really, really grateful. It means a lot. It seriously means.
Thank you for having me. You're doing a good job. What we need right now is mental health awareness. I think it's perfect time because of pandemic. People are also more attentive towards mental health needs. So it couldn't have come in a better time.
Wonderful, wonderful. I really, understand it, the need of the hour. And, this is my third series I'm doing on mental health. And the previous account was hacked, so purane sare episodes chale gaye. But I'm again creating a new audience and new episodes. But then I thought, let me start this series here with doctors, psychiatrists, because we all are seeing that जब लोग mental health की बात करते हैं, especially pandemic के बाद, I remember when the pandemic started, my God, so many calls were coming in, loneliness, confusions, frustrations, anger, ये सब बात कर रहे थे सब लोग. And I remember telling some of them that, okay, I'm ready to help you, but I guess right now it's too much. How about you consult a doctor? Consult a psychiatrist, and then I provide the counseling. मैं पागल थोड़ी हूँ, मैं डॉक्टर के पास क्यों जाऊंगा? बस थोड़ा कंफ्यूजन ही तो हो रहा है, थोड़ा गुस्सा ही तो आ रहा है, आप हेल्प कर दीजिए. And I was like, I have taken medicines by myself, and not people who only have diagnosed medical conditions, mental health conditions, go to a psychiatrist. So did you see a rise in the disorders, into mental health disorders, who came to see you? And how do you think, is the stigma still there? Did people reach out to you? How's it? And why people hesitate so much in seeing a psychiatrist?
Talking about the first thing, you know, stigma is something that is created by, I think, media, or perceived stories. You know, for example, if I have a friend who had a psychiatric illness and I saw him take a medication and I saw him have a small side effect, naturally as humans we tend to exaggerate things, right? And blame, for example, if I give a tablet, if that is causing a little bit of weight gain, but I'm not on tablets. Even I gained weight in pandemic. So what do I blame on? You know, it's very easy to pinpoint on, oh, maybe medicine, maybe doctor didn't do a good job, all this. But we don't. We often neglect our own lifestyle. Are we being at our fittest phase? Are we handling with our stress every day? So I think stigma comes from a lot of, you know, more than experiential stories. I think what they heard of, or that happened, this happened. Also, I wouldn't lie. Olden days, medications had a lot of side effects. They did come with a lot of side effects. That's same with neurology or most of the other super specializations also. But because of the advanced science, now we have the molecules that only goes and binds to the area required in the brain. So the unwanted side effects are not noticed. Relatively, they're very, very safe. So it's so I don't even I have taken medicines just like you mentioned. Even I tell that even I have taken medicines and I also took counseling alongside. I always tell patients that it is like orthopedician and a physiotherapist. You have to go through the whole thing. If you have a fracture, you can't go to a physiotherapist and say like make me do exercises and heal my fracture, right? That's not going to work. Or just get the operation from orthopedic surgeon and tell that I want to physiotherapy. I want it to heal by itself. That's also not going to happen. So you need both people. So when I tell this example, I think a lot of them, it makes clear sense for them. Also, stigma. we also create stigma, as mental health professionals by talking about mental health, mental health. No physician says physical health. They just use the word health, right? So mental health and physical health are not, Delhi and Noida, they're just one thing, it's just health. Health definition itself is being fit and active in terms of physical health, mental health, emotional health, spiritual health. WHO has defined even spiritual health. All this is health. So when we say mental health, I always talk about health. Like I call myself a doctor. I don't say mental health professional. Sometimes how we address ourselves also can generate stigma. A general physician would never tell I'm a physical health professional. He would call himself a internal medicine specialist. Likewise, I don't want to call myself a mental health specialist. I would want to call myself a psychiatrist. So stigma is there everywhere. Sometimes we also subconsciously we intensify the stigma. So you know, uh,
I totally get that. But
yeah.
I was having a live with this actor Samir Soni, and he said that why do you ask people to be mentally fit? Why can't it be just, why is it about mental health? Why can't it be about mental fitness? So
Yeah.
my thing is like, it's people don't accept that there is mental health. There is no, they just think that this physical body is there. If something happens to me, for example a fracture or a simple muscle spasm, now muscle spasm ki hum baat kare, it can be induced because of stress also, but they don't think it in those terms. They're like, oh, muscle spasm hua, let's go to a doctor, get a paracetamol and it will be all right, that it comes back after a few days. They don't think that it might be stress induced, it might be that I am in tension. They don't think that. So that is the reason we, especially my Instagram handle, it was before the previous account was mental health therapist. This is mental health careist. Because I wanted to make it sound like कि mental health ही तो है, तो क्या हुआ? जब मैं
Yeah.
डॉक्टर के पास जा रहा हूँ तो काउंसलर के पास क्यों नहीं जाऊँ?
Yeah.
Because I wanted to make it sound, but you're absolutely right, it is health. But again, then I feel like once we come to that step where we accept, okay, है कुछ ऊपर, हमारा थॉट्स भी कुछ कंट्रीब्यूट करते हैं, हमारा स्ट्रेस भी कुछ कंट्रीब्यूट करता है, then I come to that level. Oh, it's an overall health, which is
Yeah.
physical, mental, emotional, spiritual, all of that. So I guess
Yeah.
yes, we will take a lot of time to accept that, but I really like that concept. I just introduce myself as a doctor, I don't say this and that. That's amazing. That's great. So did you see a rise in this pandemic, people coming to you, or were people still hesitant?
So, I mean, fortunately, everybody asked me this question. Fortunately, I never worked in an area where there is stigma. I always, even I studied from a very popular college, so there was no stigma. In fact, our department was the most popular department in the college. We were the ones who were the most busiest postgraduates. So I didn't know what stigma was. But a lot of my friends talk about, people are hesitant and all that. But also, I think people are hesitant with any doctor. There is always a health related anxiety about, there is something called as white coat hypertension. It's a
Yeah.
medical term. When they see a doctor or anybody with white coat, immediately their blood pressure do rise, even though
Yeah.
they're not a hypertensive patient. So when they come into a doctor's cabin, also our demeanor, how we behave with the patient, do we greet the patient, all this also matter in making them feel comfortable once they come. But yeah, your question is, do they even come?
Hmm.
Um, I mean, I'm pretty busy, so I can only tell that they're coming to me. But
They do
I
come.
can't speak. Yeah, so I can't generalize my experience to everyone. Um, problem is in a particular class of community. With no offense, upper class people they come. Lower class people also do come. Problem is with the middle class community, and India is filled with most of us. They tend to neglect any kind of health. If they have headache, migraines, they will ignore. If they have fever, they'll just take a over-counter paracetamol. They don't even get a blood test or malaria test done. So just like that, they ignore mental health also. So, I mean, that's the population that we need to reach. And unfortunately, like because I speak in English in my life mostly, I think a lot of people who watch my lives are also the ones who are educated. I'm trying to go start like making series in like local languages also. So people are more, they understand what is happening. What is he talking about? So likewise, I think you have a good reach because you also communicate in Hindi, and which a lot of people do relate. I'm sorry, guys, if you're not understanding. My Hindi is okay, but I don't want to make a fool of myself by speaking now.
Oh, I have a thing for South Indians speaking Hindi. So, and when they particularly say "Kana kaya," kind of loud, and I'm like, "Yay, he said it." I studied from Bangalore, so yeah, I always
Yeah,
loved it.
yeah,
And
yeah,
but I guess what you are doing, irrespective of the language, people are still understanding. And yes, it like I also studied in English, and I provide the therapy in English. And when I'm talking to people, I can talk to him in Hindi. So sometimes, yes, it does become a problem when a person who doesn't speak English, when I'm providing the therapy, then I have to translate every word in Hindi, and then it becomes a problem for me. And God forbid if it is a hypnotherapy session. And then I'm like,
yeah.
okay, this is very tricky. So I even
Right.
tell them, I tell them, look for a regional counselor because my one word can make or break your life. I
Yeah,
don't want to affect you that way. So if it is a regional speaking, you have problem with language, go to a regionally speaking doctor. It will
yeah,
be more helpful.
yeah.
So yes. Now,
Also, I want to,
yes.
sorry, I want to clarify that I speak five, six languages. So people who think I only speak English, that's a misnomer. This is for the people
So
who
which
are,
are the five, six languages you speak?
I obviously speak English, I speak Hindi, I speak Telugu, I speak Malayalam, I speak Kannada, I can manage Tamil. So, yeah.
Wow, I'm a part of an organization called ORDI, Organization for Rare Diseases in India. Now, these rare diseases vary from, for example, I live with cystic fibrosis. I have a genetic medical condition. Then there is Alagille syndrome, muscular dystrophy. All other things are there in our group, and we are always in need of these psychiatrists or mental health professionals who can speak multi languages because some are from Karnataka, Tamil Nadu, then north, coming down to north, or Andhra Pradesh and all. So yeah, I should introduce you to our circle there. It would be amazing. But
Yeah.
that's so nice. So yes, my next question is, okay, people think that there is not a connection in physical and neurological conditions. Sometimes they don't want to believe it, they don't agree, and they keep going to internal medicine doctors, or they just orthopedicians. I remember this my sister has a physiotherapy business, so a lot of neurological cases. And when people will come to consult her, and she would say that you should see a neurologist, and people will go to an orthopedician. क्यों? क्योंकि shoulder में spasm ही तो है, muscle tension ही तो है. She would be like, no, you have to go to a neurologist. So what is the intensity of connection between physiological and neurological health?
I'll keep it very simple, right? I mean, brain is the master of your entire body. So brain regulates every single organ, every single cell of your body, and they all relate with each other, interconnect with each other at different levels, at primary, secondary, tertiary levels. Now, there are different areas of brain that deals with different functions. Some deal with physical functions, some deal with psychological functions. For example, if I have a blood clot because I'm a hypertensive, or I have a cardiac condition, or I'm a diabetic for whatever reasons, or my cholesterol is very high, it formed a clot in my brain. Depends on which area of the brain has a clot, which area of the brain is deprived of the blood supply, you will have those symptoms. That is called as stroke. By and large, most of the strokes are motor in terms of movement gets affected. We all equate stroke to paralysis. आपको stroke हो जाएगा मतलब paralysis हो जाएगा. That's what we all think. But there are different kinds of strokes. There is motor stroke, there is sensory stroke, then there are different frontal stroke, occipital stroke, different areas. So if my blood supply is cut off in this particular area, it's called frontal lobe of the brain, I won't have any motor problems. Depends on the extent also. I won't have motor problems. I'll only have behavioral problems. That is also stroke. here often diagnosis is missed because we'll be like, oh, why is the patient behaving so abnormal? Why is patient behaving so weird? Why is patient removing clothes in front of everybody? Why is patient? So it's easy to label them as pagal ho gaya, or like gone bonkers or something like that. But that's not true. Immediately, my first, as a good doctor that I assume I am, I immediate first thing that I would do is get a neuroimaging done, because sudden behavioral change doesn't occur like that. I won't sit and think maybe he's stressed, or like maybe he, I think beyond that, right? I think like, okay, you know what, something is wrong. Immediately I get a neuroimaging, there's a big clot sitting here. If I don't treat that, if I'm just treating him for his hallucinations, delusions, it will worsen. It could be his deathbed. So every area in the brain deals with your body function, some psychological, some physical. So I don't see how they are so different. It's not like front part of the brain is psychology and rest of it is physical. It's not like that. They can be next to each other also. So if I'm thinking, for example, right now when I'm speaking to you, I'm thinking and speaking, right? Or I'm understanding what you're saying. All these are psychological functions. Speech is a psychological function, it's a higher mental function. All these are dealt by a psychiatrist only. So just don't think that only depression, anxiety is what psychiatrists deal with. There are a lot more diseases, and physical health, mental health, it's all regulated by the brain. I tell all my patients, but my patients are very smart. They ask me, but then physical symptoms you can experience, you can see, no? So it's easy for us to recognize. Then I tell them, do you see pain? When did you see pain last? You only experienced it. And pain is by far the very common Indian complaint that we go to doctors.
Yeah.
Then when you say, I'm feeling pain here, why can't you feel pain here? Why can't you feel that heartache, and not heart attack, I mean, what I meant was feeling bad and feeling terrible. That is also a concern. Why is that being ignored? So I don't know, I mean,
So, before I did the hypnotherapy course, like I have cognitive behavior therapy and positive psychology and all backgrounds. But before I did the hypnotherapy course, there are like these characteristics, like kind of personalities, physical and emotional. So, usse pehle, what used to happen that whenever there would be something heartbreaking, and I would feel a pinch or ache here, like, and I would tell somebody, and they would say, how is that possible? And then after I did this course, and then they talked about this physical and emotional and physical personalities of the people, where in hypnotherapy language, where the mind and the heart is really connected. So what you feel it physically. Like, for example, we say the panic attack. You feel
it's
it
called,
physically.
sorry, it's called vagus nerve. People
Whoa!
realize this. Vagus nerve is what is connecting this both.
Say, so that's how, and then I was like, oh my God, that is the reason I can feel the heartache. And yes, it is totally connected. And I really appreciate how you put it simply, that brain is the master, and if something is happening there, it can affect us in different forms, physical or psychological and neurological, and it can definitely. So yes, it is connected. Thank you so much for that, and the Vegas nerve. Amazing. Thank you. And how frequently do you encounter cases of substance abuse in your practice?
Unfortunately, a lot. Unfortunately, these are school going children. Um, Unfortunately, there is also sexual abuse and a lot of other factors. Unfortunately, they come from broken families. So it's not just one thing that leads to substance use. So why it's used, unfortunately, so many times is that all this could have been rectified. They didn't have to get there. Very few people get into addictions out of curiosity.
Totally,
Yeah.
totally understandable. From past 2, 3 years, I have been doing family therapy and relationship counseling. And I was talking to a colleague therapist other day. I said, it is by far, like, I'm not saying that any other challenge people are facing is
Yeah.
little
Less.
or
Yeah.
bigger, but
Yeah.
I feel like it is when you see a person has come from dysfunctional family and you are able to help that person, you feel like you are fixing a family. You're
Yeah.
helping a family to bond. You're helping a family to get back to health. And yes, totally understandable. I second you in that. It's not about that people are curious about it, but it is always that something is going on in their life. Even adults, experiencing exploring the options of this MDM, ecstasy, and all that, I see either they are feeling really lonely or something terrible is happening in their life, career is not working or something. And then they are like, okay, I want to go on this trip and I want to understand this, what is happening in my life. I tell people that is not the way to find, to explore. But yes, it is very
Yeah.
unfortunate that you get to see a lot of children.
Hmm.
Okay, so can medicine, okay, we talked about this. What are some ways and measures one must incorporate to maintain a stable and healthy mind?
By far, the most important thing is sleep. I think I personally believe sleep deprivation is one of the main reasons why people are coming down with a lot of mental health problems and even physical health problems, cardiac problems, even endocrinology, hormonal deficiencies or surplus. All that is related to sleep. Because just understand, can you run your air conditioner all through the day, all through the week without resting it? You can't. Something so trivial like that can, can just get spoiled. What about your brain? If you don't give it enough rest, because it's designed, I don't know, designed, created, whatever, in a way that it can only work for these many hours, and it can't beyond particular hours. So we all tend to either consciously or voluntarily or involuntarily tend to keep ourselves up. Even if you see kids these days, like when I go hang out with my friends who are married and who have children, they are hanging out along with us till 12 o'clock. I mean, I remember being a child and I was put to sleep by 8 o'clock or 9 o'clock. I don't know what's happening with this generation. And I sound like an old person, but it's unfortunate. Every 5 years, the generation is changing, compared to olden days. So sleep is the most important thing. Please never neglect your sleep, and don't think that just because I'm functioning with 6 hours of sleep, that is okay, because health is not cross sectional, health is longitudinal. Today I'm okay, but I won't be okay 5 years from now, or maybe 5 months from now, or 10 years from now. Whenever your actions today that you take will leave a long lasting impact on your health for much later, and you don't want to suffer. Early in your life or later in your life, also for that matter. So, sleep is very, 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 very important. You have to get your sleep. If you're not getting sleep, please see a doctor. Please take medicine. Sleeping medicines are not dangerous at all. There are some olden medicines that was causing addiction or dependence. That was if you use it for years together. But now the science has evolved so much that even sometimes I take sleeping medicine when I'm not able to sleep, because I know if I don't sleep, the impact is horrible compared to taking a sleeping medicine. So I'm always doing a risk and benefit analysis in my head. I'm like, okay, it's a calculated risk. It's better I take a sleeping medicine than not sleeping at all. You know? So that's the
Wow,
first thing.
that
Yeah.
that's such a beautiful thing, because I also remember, I don't know
Yeah.
if you know Dr. Puneet Dwivedi. He is in Fortis. He's a psychiatrist, and Sir and I have been, I have been seeing him for years. Every time I have a problem, I just run to him, and I was having difficulty in sleep, and all I did was I went there. Being a meditation practitioner, yoga practitioner, and all the mental health therapies I know, I tried it for myself and it didn't work because I was going through a rough patch of my life. So I was like, okay, one, एक तो stress है because situation अभी खराब है. I have to deal with it. I have to stay stronger. Now on top of that, if I'm not getting good sleep, my decision will be like flawed. I will not be able to make better decisions. I'll not have
Yeah.
energy. And third, it is going to affect my career also. I will not be able to work. So all I did was like booked an appointment, went to sir, and he did not, you mean, he just gave me one spray, melatonin spray. And he's
Yeah.
like, just take the spray and see how it goes. 2 or 3 sprays, nothing more, Aruba. I was like, okay. And I did that magically. I slept well. It
Yeah.
wasn't that I overslept. I didn't have any swelling in the face in the morning, nothing. But when I was not sleeping, I was getting gastro problems. I was getting acidity. I was getting
Yeah.
pimples on my face. I was getting heartburn. All these things were happening. But
Yeah.
when I just slept well, it was good. It was amazing. I could take better decisions. My work did not get affected. So yeah, as you said, लोगों को लगता है, people think that it's addictive. Once they get
Yeah.
addicted to it, and as a counselor, when people come to me and I tell them that you haven't slept for a week, my meditation will be a blanket. It will be a temporary relief for you. Sometimes my other meditation practitioner friends tell me, हाँ हमारी practice तुम बंद करवा दो. But I do tell them that meditation is a temporary relief. What I want you to do is go visit a doctor, get medication. Even week 10 days is good for you. And
Yeah.
then the client looks at me and they think I have a percentage fixed with the doctor. I'm like, hello. All I'm saying is that take all the assistance you need to get better.
Yeah. Yeah.
I
And
have a,
also,
yeah,
yeah, sorry,
sorry.
sorry. Also, if you go to a doctor, it's not like I'll put a pill down your throat. I will assess if you even need medicines or not. Sometimes you don't. So I'll tell you, like, I'll tell you some sleep hygiene techniques and probably follow it and see, and then come back if it's not working. Or I'll see what is the other reason. Do you have sleep apnea? I might do a sleep study on you. Or sometimes, I'll say meditation just works for you. That's enough for you, because with meditation you'll calm down your thoughts, and so you'll go to sleep. Try that. So don't think that just because you walked into a room, I'll give you medicines and send you back. And sometimes if I do, the blame is again on patients, because they will think that I spent 800 rupees for this doctor. Didn't prescribe anything. He just said, like, the things that we could read off the internet and send me back. So I don't want to look like a terrible doctor. So I might give you some medicine. So you and the doctor need to have a healthy relationship in terms of, because I'm a very transparent doctor. Usually it works, but some people will be like, they come and ask me, can I get a scan done? Can I get a scan done? I'll be like, I'll assess that. Give me some time. And in the end, I'll say, no, you don't need a scan. They're like, oh, I don't need a scan. But can I get a scan done?
Dog is covered in the insurance. We are like,
So I tell them, why do you want to get exposed to radiations unnecessarily? When there is need, I will send you. I mean, there's no way I will deny the need of it. When there is no need, when I can diagnose you without a requirement of a scan, so it's not needed. So patients need to first trust in your doctor. But yes, sometimes it's not easy, because doctors also have to be blamed for. Then get a second opinion, get a third opinion. What do you lose?
and
Yeah,
up to it's become easier because of the pandemic. The
yeah.
consultations have moved to online.
Virtual. Yeah,
You
yeah.
can, yeah, you can just book it from the comfort of your home, have a
Yeah,
second, third opinion, whatever you want.
yeah.
And do you are people able to consult you? Do you give consultations via virtual media?
Um, Honestly, I don't like it, but I've been doing a lot of virtual consultations. Actually, I think I'm getting more and more busy with virtual consultation, but I do miss my consultations in my
It's
OPD.
like it totally you
I mean,
feel that.
yeah, that's what I become doctor for, and the virtual thing is little too much for me. But I mean, it's better than no help. Some help is better than no help. So yeah, why not?
Okay, so we talked about, you said number one is sleep. So sleep we did talk. Number
Yeah,
two,
hydration. I cannot tell you how important it is for you to hydrate. See your brain as a car, and it needs fuel. No car is going to run without fuel or electricity, if you're talking about Tesla. But you need fuel for your brain, food for your brain. That is nothing but water, just plain water, oxygen, and sugars. Sugars is not like eating sweets or ice creams. Any food that you eat is going to get converted into glucose any which ways. So these three are very important. If these three are not in its place, you will have all kinds of symptoms. Sometimes you won't believe, rarely. When patients come to me, I ask, how much water do you drink a day? They're like, 2 glasses. I tell them, go back and come visit me in 10 days, but you're going to drink 4 liters a day. You're going to put 4 bottles with your name on it, and you're going to drink and come back and tell me if you still have palpitations. Tell me if you still have anxiety. Tell me if you're still not able to sleep. Some people came back and said that it didn't work. I'm a little better, but not enough to work productively. But some people came and told I'm doing very well. So hydration is the most important thing. In India, we have a nasty habit of eating 2 meals and drinking 2 or 3 meals and
two
drinking
glasses.
water right after you eat. That's all we do. We don't, unless it is summer and you're in a place like Hyderabad, then probably you will drink more water. Otherwise, you don't. In spite of you being in a hot climate or cold climate, doesn't matter. Your body and brain requires 3 to 4 liters of water, unless you have a renal failure. So yeah,
Wow, wow.
yeah,
Yeah, I do drink fair amount of water, and if I'm not able to, at least I try to have this, water, honey, and lemon. So I
yeah,
just
yeah.
mix it, and at least while having the consultations or anything, I just keep drinking. That keeps me hydrated. But before that, I want to ask you one thing about the sleep thing. So people have this. You said sleep is important. Now, 8 hours of sleep is amazing. 6 take care, but eight is amazing. But people sleep around too. People sleep around 1, 4. What are the healthy hours of sleep? When should actually one go to sleep so that we get all those healthy hormones released in our body which we need?
So just like how you have a clock outside, you have a clock in your brain. Um, it's a small gland that releases melatonin, so it has to match. So the clock in your body, the biological clock, is 25-hour long, whereas the clock outside is 24-hour long. So there's little desynchrony. That is normal. But if you are, I don't want to use word desynchronization. What I would tell is, if my clock in the brain is not matching with the clock outside, you'll have problems. You'll have all kinds of problems. Not mental health, physical health. Call it anything. You're gonna go to ashes. It's not good. It's not good at all. So try to make sure that you're sleeping when it is dark, and you are up when it is bright. You shouldn't be sleeping when it is bright. That's a whole simple thing. You pick the hours. I mean, I can't tell you 9 p.m. or 10 p.m. You see the hours. When it is bright, the sleep that you're having isn't deep sleep. It is only there are different stages of the sleep. It is only superficial sleep. But you need deep sleep. If you're sleeping at 2 and by 4 it is bright, so the melatonin hormone production is stopped, then you won't have a good transition of sleep cycles or stages, I call it. So try to sleep a little early and wake up early. But if you're not able to do that, for example, I am a night owl. I don't want to wrongly educate you, but just because I'm not doing it, that doesn't mean that I shouldn't preach you. But I still want to tell you the right thing, instead of me doing it or not. I'm being honest here. So I sleep around 1 o'clock, which is not good, but I sleep around 1 o'clock. But I'm waking up around 7 or 7:30 or maximum 8. But I make sure I'm maintaining these timings every night. I'm not gonna erratically confuse my brain. One day I'm sleeping at like 12, one day I'm sleeping at 1. Like, maintain your sleep schedule at least. That is important. And don't take naps in the day. When you take naps in the day, your night sleep will get disturbed.
Oh, that's what I have been telling everybody. Like, yeah, last night I could not sleep really well. And because of my respiratory condition, I do have disturbed sleep.
Yeah.
Sometimes I just want to breathe and I want to wake up. So, and then today during the day, I had 2 hours free, and my health just said, why don't you take a nap? I was like, then I won't be able to sleep in the night, and I don't want to
Yeah.
disturb that. I want to go back to sleep. But people have developed this during the day. They take a nap. They're like, अच्छा ठीक है, रात को नहीं सो पाए, दिन में सो जाएंगे, and then the whole clock gets disturbed.
Yeah.
Yes, that's like really amazing. And that, I guess, whatever in the olden times was, it was for a reason, that have your dinner before sundown, go to sleep around 7, 8, and then wake up around 4, 5 o'clock, because that is the time sunrise happens. So yeah, it was for a reason.
I mean, it was, I think they had it perfect. They had it figured out without help of doctors, without help of
Yeah.
advanced science, without help of these many specialists. Nothing. They figured out just by understanding the nature. That's fantastic. Yeah.
Amazing. Okay, so the first goes sleep, second goes hydration, and the third goes?
Third, I think probably the most important thing is stress. Understand, stress is constant. That's not going to go away. If you take my medicines, or if you see Dr. Aruba, stress is not going to go away. What we're trying to do is, we're trying to change how your body and brain reacts to stress, or how you perceive stress and how you process it and how you let it out, is what we are looking at. So patients ask me, so when I take this, stress is going to go away? I'm like, no, it's not going to go away. If you're stuck in a bad marriage, that's not going to go away. If you are in a high stressful working environment, that's not going to change. The only thing that can change is you. So how you process it, how you try to place yourself before stress. You're going to be like, okay, you know what, this is affecting me, this is too much, and I'll take an easier route. There is this movie called Dear Zindagi. The one line I think that I could relate was, he said, "Why do you always have to take a hard route? Why can't you sometimes take a simple way, simple path?" That's actually right. Sometimes you just have to take a simple path. If you think your work that is paying you a lot of money is damaging your health, and you're anyways gonna spend that money taking care of your health, might as well take a job that is gonna pay you a little lesser and save your health, and you don't have to go through the doctors, hospitals, therapists, nothing. You can be fine. So why not? I know I'm putting ourselves out of job, but doesn't matter. I'm okay. I mean, the people are fine.
No, that is the first thing I tell a person who comes to see me now virtually, post 45 years of age, I am like, okay, and they say they want the results immediately. The
Yeah.
problem has that there been for 20 years, and they're like, एक सेशन से तो ठीक नहीं हो रहा है, मेरे को तो नहीं आराम आया. So I'm like, all your life you built up so much stress, made so much of money. Now you're going to doctors, to doctor, to doctor, and counselors, to counselors, to counselors, spending all that money. I wish you had just figured it out then. And then I tell the people who are in younger years, when I tell them this, and they say, नहीं, ambition भी कोई चीज होता है. And then, okay, hmm, Dr. Charan, can you hear me? Because your screen is frozen. Oh,
Can you see me
better
now?
now. You're
Yeah,
back. Yeah.
yeah.
So yeah, that is when I tell the younger generation, they're like, ambition bhi koi cheez hoti hai. And when they come in the later years and they say, yeah, I think I should have been easy on myself. You are absolutely right. Absolutely right. Now we have certain questions. I want to take them. Uh, why do I feel numbness in body? Sparkling diva.
So numbness is a sensory deficit. Sometimes in anxiety, some of the nerves they don't work, so you don't feel the sensation. You feel numb. Sometimes they are exaggerated, so you feel too many sensations. They're called paresthesias in medical language, where you feel like your body is tingling, you're having pins and like pricking sensation or burning sensation, etc. So it could be because of anxiety, but yeah, we'll have to check. I mean, there are different conditions also. There are nerve dysfunction, so we might have to do a nerve conduction study, or maybe just a simple history. So I think you'll have to consult the doctor once. Yeah.
Okay. The next question goes, how safe is it to consume melatonin oral supplements, and whom should one consult before taking one? Seek asylum.
Psychiatrist it is. I mean, we are the ones who deal with sleep disorders. So you can consult a psychiatrist. Don't take them over the counter, because if you're having sleep disturbances secondary to depression, just taking melatonin is not gonna make it go away. So you'll have to get evaluated, and then if it's sometimes it's no depression anxiety, it's just your biological clock. You're not sleeping. You need that extra melatonin boost amount. Then we'll give you. So you'll have to see a psychiatrist. Yeah.
Okay, okay. And like, I didn't know that, people do take oral melatonin
They
tablets
take.
because, okay, they take. And
Yeah.
yeah, then that depends on the seriousness. Doctors will give either the spray or the oral medication. Okay,
Yeah.
great. So I guess, I really had these questions figured out, but what is your message for people? One who do not visit the doctors on time. Before that, I want to share this one client of mine from. I have so many clients from Andhra Pradesh, different places of Andhra Pradesh. Like, I know they in the villages like Anakapalli and all these places
Yeah.
through my
Yeah. Yeah.
clients. And I love it because people are there very open. They seek
Yeah.
help. They don't
Yeah.
feel shy about it. They don't think it is a stigma. They reach out, and these people are not very highly educated people. They
Yeah.
are people who can just afford maybe a couple of sessions, and they're like, I just want to get better. And I just love that. So she was seeing a psychiatrist, and psychiatrist asked her, "You have to consult a counselor," and we became therapist client. And one by one, after a few sessions, when she visited the psychiatrist took one medication off. After a few sessions, she again went, he took another medication off. And after like 3 visits and 1.5 months of therapy, all the medications were off. And there were no withdrawal effects, so there were no side effects, there was nothing as such. I want you to talk about this so that people understand that it is all right to go to a doctor and take medications.
I mean, I don't know whom to show you as a bigger example than me. I had depression in my teenage, and I went and I taken medicines. Obviously, I had my own doubts about medicines, but I do believe in doctors when I was not a doctor. So I took medications and I got better. And I think I was given antidepressants for maybe a year. I'm not really, I can't recall, maybe a year or 9 months, and I'm better. And ever since, I didn't have an episode. They told me that I could be having another episode. There is like a 10% chance, but they told me, always put yourself first. Make sure you're gonna walk over stress. Just ride the wave. Don't giving yourself a stress. Even if you're gonna fail in exams, that shouldn't matter. If you're gonna have a breakup, it shouldn't matter. If someone passes away in your family, it shouldn't matter. In terms of, it's
Yeah.
not it's not above you. It's not above you. You have
Yeah.
to take care of yourself first. You don't have control about these things that can happen with you or to the people that you love. That somehow changed how I start looking at life, and now I'm prepared for the worst thing always. It really doesn't shake me that much. I'm always gonna sit back and be like, okay, you know what, maybe this happened because something else, something worse could have happened to me, right? Maybe it's good that this happened to me rather than that. I'm always trying to think positive. It could be irrational, it doesn't matter, as long as that's giving me some comfort and solace. That's all that matters. So ever since I didn't have an episode, I'm doing fantastic. So I went on time because I come from a family of doctors, so they understood the need and they took me. But unfortunately, for some people, parents, even if they want to see a doctor, they'll be like, no, no need, no need to see. And they will come very late to doctor, and by then the damage would have been too much that it will take longer time or too many medications to improve the condition. Too many medications, you might have side effects, and to counteract the side effects, I might put you on another medication. It becomes a mess that no one wants to put themselves. So I tell people, you are the best judge when you need to see a doctor. No one needs to tell you. No Google, no doctor. No one needs to tell you. When you know that these symptoms are affecting my life, my personal life, my professional life, my day-to-day activities. I am not able to surface. My friends are not gonna able to help me. I'm not able to help myself. Please run and see a doctor. Don't wait. What do you lose? Right? If doctor is not able to convince you to take a medicines, don't take, but at least see a doctor once. So the timely need is important.
And I got one thing out of this. So you being a psychiatrist, and that to a neuropsychiatrist, and I being a mental health counselor, and we are dealing with people's brain, emotions, mind, whatever they want to call it, and we both have been on antidepressants, and we have not had a relapse episode, and we don't have a problem in our judgment right now, so the medication is absolutely all right. It is safe to take, because a lot of people do message me that if I go to a psychiatrist, would it affect my career, would it affect my decision making tomorrow, would it have side
It
effects?
will. It will affect for the better.
Yeah. That is amazing. So, guys, you are watching here two people who have been in depression, and now they are in this field helping others, one through medication, one through therapy. So you should not think twice before wanting to see a doctor. Now we have another question, that seek asylum is say, thank you so much. My 14-year sister was asking for one because apparently her friends are taking melatonin. Oh my god.
There are no gummy bears. No.
Yeah. Okay. Reason of dehydration in the night in spite of drinking a lot of water in the middle of the night.
How do you know you're dehydrated in the middle of the night?
Maybe the person feels thirsty.
You should drink water if you're thirsty. There's nothing wrong. But if you're having thirst all through the day, excessive thirst or excessive appetite, you'll have to check your sugars tested, the glucose levels tested. Yeah.
Yeah, yeah, and I guess everybody should get. पता नहीं लोगों को क्यों ऐसा लगता है, either when we get insurance or when we get older. And when I say older, that is coming into early 30s, which I am in, and I'm seeing everybody around me. Up they are like, oh, I need to get a medical checkup done, and that too they get it annually. I'm like, hello, how about getting it in 6 months? There is nothing to lose. It's just some few blood tests here and there. It's okay. And I guess everybody should get that done, because coming with so many lifestyle disease, hypertension, then blood sugars, and then thyroid, and then PCOD, blah blah. So I guess people should get that done so that they can get to know on time.
I mean, I have a slightly different take on this. I mean,
Mm-hmm.
as early as 30, you don't need such regular checkups.
Mm-hmm.
Unless you're having symptoms, obviously, then you'll go to a doctor and he'll prescribe. maybe someone after 50, it's good to get a routine 6 months, or if you can't afford 55 is also fine. Because why I'm saying this is lot of patients, they're unnecessarily getting too many tests done. When I ask them for four or five tests that are required, they get the entire spectrum of tests done. Some things that I don't never even heard of. Some enzyme in liver, like not liver. Liver enzymes are important. Some organ, some enzyme, which I didn't even know that the test existed. So you don't need too many tests, is what I believe in. I'm sorry if I'm conflicting you.
No, no, that's
Um,
absolutely fine, and it's a good
yeah,
thing that
yeah,
you're saying that. Yeah,
yeah, yeah.
I
Because
like, as I said, I live in a genetic medical condition, so maybe I have been used to
yeah, yeah.
from
No, no, no.
21
Of
years
course.
of age.
No,
Yeah,
absolutely. Like if you have genetic conditions or if you have metabolic conditions that can be passed from your
yeah,
family, you should. But most of us don't have it, so you don't need regular tests done. I think just trust with the doctor. If he says it's required, get it done. If he says not required, just let it be. But
okay,
after 55, make sure you're getting it for your parents. 55, 60 at the worst. After that, every 6 months or 1 year, depending on how you can afford, get regular tests done. But don't go and ask a diagnostic center, what all should I get it done? They will, I mean, I'm sorry, they
yeah.
can tell you any kind of better or expensive things. What is required is enough for you. Yeah.
So the doctor has to say. That's amazing. Wonderful. I guess, I got amazing information which would be very, very useful for the viewers, for the audience here. And once again, I am really grateful for taking out time and giving this time to me and talking to all of us. Thank you so much. Thank you so much. And I'm
My
really
pleasure.
grateful.
My pleasure. My pleasure. I'm sorry. I want to take this
Okay then.
question. I want to take this question.
Uh-huh.
Is there a permanent medicine of schizophrenia? I think what he means is a permanent cure for schizophrenia. So schizophrenia is a chronic
Yeah.
condition. It is 1% common. 1% common is big chance. That is one in every 100. Early diagnosis and early treatment is the key. I have so many patients. Early medications were given, and they might have to be on medications for definitely few years, but hey, so are diabetics and hypertensive. So there's no need to stigmatize schizophrenia. So, you'll be fine. But definitely there is cure for schizophrenia. Rarely there are resistant schizophrenia cases that might have to be given electroconvulsive therapy and multiple other medications, etc. But that's any disease, right? There can be resistant cases in every disease. So, yeah.
No, I guess, and I also do have a number of clients who were diagnosed as schizophrenic in their early years, and now they're
Yeah.
off medication, but they choose to stay on therapy. We call
Yeah.
it maintenance therapy once a month or once in 2 months, just
Yeah.
to keep themselves back on check.
Yeah.
Otherwise, I have seen people going off medication for good.
Yeah.
Yes.
Yeah. Yeah. All right. Thank you. Thank
Yeah.
you for a
Thank you
great,
so
great, great
much. Good
evening.
night,
Yeah.
doctor. Thank you.
Yeah. Take care.
Take care.
Take care.
Bye.
Bye.
Hey guys, that was Dr. Charan, and we had an amazing conversation about neurological disorder, how is it connecting, and sleep, hydration, all these things we talked about, and it was an amazing conversation. And he shared amazing inputs. So I guess people who have not been here, you can share it with them. You can share it with your friends, with your family, so that it helps people, more and more people out there. And you help me out creating more and more awareness about mental health, breaking the stigma, getting the help we need on time. And once again, thank you so much. So this was the episode 2 with Dr. Charan on Let's Ask the Doctor. Stay tuned for our next Thursday, 7 p.m. with Dr. Era. And I'm keeping that as a suspense, a surprise for all of you. But yes, it is going to be worth your time as it was today. Once again, thank you so much. Good night, guys. I know I had a question, but I lost that somewhere. It was, I wanted to ask something. I am unable to move on over a toxic relationship from past 1.5 years. Oh my God, that is, I hear you and I know it is painful. Sometimes we get used to the comfort of being abused emotionally, mentally, physically. because we think that's what we deserve. So ask yourself, what is it that is making you to stay there in that relationship when you know it is not healthy? Number one. Number two, look back on your family and see the relationship of your mother and father. Reflect on it when you were as a child. What kind of a relationship have you seen? What kind of a person your father was? And क्या आपके फादर में और क्या इस पर्सन में सिमिलैरिटीज है, क्या totally repulsive hai, what is it? So maybe you will get answers there, because we have a tendency of choosing similar partners, can who sound or who behave like our parents because it sounds familiar, and we think it's normal. But listen, you deserve more. You need to prioritize yourself. You need to love and accept yourself. That is the key. You should not let yourself get disrespected. That is something you need to understand. And you definitely, definitely deserve a healthy relationship. Yeah, that's what I want to say. And thank you so much. Thank you so much. And hi, ma'am. A lot of respect. I'm not a doctor. Just call me Aruba. Yes. Thank you so much, Samrit. And थैंक यू सो मच ऑल ऑफ यू. गुड नाइट. और मैं आप सबसे 10 बजे मिलूंगी. यू नॉट लेस देन गॉड. नो 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 नो. गॉड इज गॉड. आई एम मी. यू आर यू. Everybody has their own place. But thank you so much. Okay, guys. Bye. Good night. I'll see you at 10 p.m. again.